500,000 people in the U.S. undergo knee replacement surgery every year. I know somebody just a few weeks ago had to do this procedure. Well, it requires several weeks for a complete recovery, so the healthcare industry is always working for ways to improve the patient experience. I have Dr. Bennett from Conway Regional here with some information on robotic-assisted surgery and the benefits it offers patients. So let's just first talk about what are the different reasons and causes people need to get a knee replacement surgery, Dr. Bennett.
Yeah, so the primary reason that people need knee replacement is pain, and pain related to osteoarthritis. Typically is age and genetic related. The second most common reason would be post-traumatic arthritis of the knee after
like an injury or something?
Like after an ACL tear, a meniscus tear.
So most people are probably older, but then sometimes if you're younger and you have an injury, you may need that, right?
Yeah, so the average age of knee replacement patients is about 60.
Okay.
Certainly some patients are much younger, have patients even in their early 40s for knee replacements. What's
the percentage difference between men and women? Who have most?
Women have about 60% of the knee arthritis, so slightly more affected than men.
Any idea why that is, or?
No, really, we don't.
Or men don't speak up. They just, well, I'm just going to.
Yeah, women live longer. So
women live longer, and men just don't go to the doctor that much either. Yeah. So if you, what are some things you can say? If someone has some severe knee pain, what do they need to do first? I mean, obviously, after talking to their, need to, I guess, talk to their primary physician.
Yeah, of course, primary physician or orthopedic physician. Obviously, there are lots of non-surgical treatment options for knee arthritis pain, and I believe that you should utilize those. But at some point in many patients, these fail, and at that point, surgery should be considered.
It's time to bring out the big guns. And of course, the medical industry is always trying to do things to make it the best technology as well. So what we've got behind us here, we've got a conglomerate of contractions.
Yeah.
What do we have here behind us?
So this is the Mako robotic arm. This is robotic technology for partial knee replacement, total knee replacement, and total hip replacement surgery. Basically what this does is this technology creates a three-dimensional model of each patient's individual anatomy based on a preoperative CT scan.
So you do that before you'd even come into the operating room,
After they've decided that they're ready to have surgery, the CT scan's performed. Then we can evaluate the data several days prior to the operation, come up with a template, a preoperative plan, determine what size the patient needs, determine the positioning of the implant. And then at the time of surgery, the robotic arm here behind me is actually utilized to make the precise cuts and precise, accurate.
I mean, this is down to the micromillimeters, right?
A quarter of a millimeter.
Wow.
Half of a degree. It's
now,
extremely
that is the head there. Like, do you have attachments that go to that?
Yeah. So there would actually be a saw blade attached to this, and the surgeon holds this. So it doesn't drive itself. You still have to hold on to the.
But just allows more like a finer cut.
Oh yeah, it's much more precise.
Does it allow to be less intrusive than more traditional means?
It can decrease the amount of bone removed in the procedure, which particularly for younger patients may be important. If they needed to have a revision down the road, that would be important to preserve bone at the primary surgery.
Does this help in any of the recovery time afterwards? Does it speed it up any?
There's some studies that indicate it can decrease the pain that patients experience. I think it can improve the range of motion and the balancing because of the precision of the implant placement. So it can accelerate the rehab process for patients. Yeah.
All right. Well, Dr. Bennett, thank you so much for being here with us this morning. Appreciate it so much. So many fascinating things that are happening. And thanks for everybody from Conway Regional helping us out this morning. All right, we're going to go to break. We're going to have the answer to the Coffee Talk Trivia question when we come back. So stay with us here on Good Day Arkansas.